My career sucks.
Sex just isn't the same.
What's my purpose?
Where did this fat come from?
My relationship is killing me.
I'll never be happy.
My debt is piling up. I'll never find love. Why can't I be like other gay guys? Hey guys, it's time to get a grip, stop whining, make a bold move, and do something amazing with your 40-plus gay life. Let's get to the show with your Tell It Like It Is host, Rick Clemons, who does his best to never act like a dick or a diva unless you act like one first.
Hey guys, it's time once again for 40 plus gay men gay talk. And just a quick reminder, join our Facebook group, go over there to the community. We have a lot of stuff going on over there. But before you go rushing over there, stay seated, pay attention, because today we're talking about penises. And I know most of you who listen to like, yay. Some of you might be going, oh, great. This is where we're going. I want you to just trust me on this one. We're going there. We are also doing this as a video podcast. So if you want to catch that, catch it over on YouTube. But why are we talking about this? Well, my guest today is Dr. Joel Pash, and he's come to a space where he helps men really embrace the things that they can do when they're having issues with their size and maybe some blockages and all these sort of things that happen. I'm a 61-year-old guy, and there's been a couple of times I've already like freaked out because something's not working exactly correctly. Well, he's here to talk to us about his upsize clinic and the things that they've done to help men feel really good about their penis, their confidence, and all of that sort of stuff. He is from the Bay Area. He got his medical schooling in the Midwest. And I just love the fact that he's got this lovely clinic called the Upsize Clinic. So, Dr. Joel, please give us all your insight. Welcome to the podcast. I can't wait to have this conversation, man.
Thanks for having me, and it's going to be fun.
It will. I'm sure it is. So, most gay men, they'd go, wow, he gets to talk about penises and play with penises all day long. They would be in freaking heaven there. But what took you into this work? What was like, hey, I really want to be in this space. I know you have an anesthesiology degree and all these sort of stuff, but what led you to this space yourself?
It certainly wasn't that I wanted to look at penises all day. So as you said, I am an anesthesiologist by training. I do in that part of my career, lots of injections and, it's also obviously pain management and these kind of things. But I was actually looking for, I was trying to get out of anesthesia into some sort of cosmetic medicine. And I found out about this procedure through actually a marketing guy who I talked to, who was doing marketing for a guy that was doing penile enlargements in Florida. And it's something I'd never heard of before. In a million years, I would have never thought I'd be doing this. Certainly when I was in medical school or anesthesia training, it would have been the last thing I thought I would have done. But my wife and I kind of looked into it, and mostly to find out if it was real and if it was something that works. And we determined that it is something that works. And that was in 2022. And since then, we've enlarged thousands of penises.
Awesome. That sounds so fun. Well, we've enlarged we enlarged penises,
well,
but
when I say we, I mean me, not my wife.
No, I get that, but it's such an interesting thing because men in general, and of course gay men, specifically, I think I shouldn't say that because there's gay men that are like, yeah, I don't care how big it is and as long as it works. And then there's gay men who are like, I'm totally cool if it doesn't work. I'm not really into penises. I'm more into whatever. But as men, I think this is almost our mark of manlyhood and masculinity. Like our penis kind of determines some of our confidence. I would assume that not everybody who walks in to your practice is like, it's so small, I just need something. There could be other stuff that they're like concerned with. Is that correct?
Yeah, I think you're right. It's not a gay thing or a straight thing. It's a man thing. I mean, I have all kinds of patients. I have quite a few gay patients, quite a few straight patients. I have all races and religions and everything. The only thing in common is they're all men. And guys do have varying degrees of concern about their penis. Like you can have a super monster huge one and not care, or you can have a little one and be totally happy with it. And so your point there is true. We're generally making normal penises bigger. Now,
Mm,
what I consider normal is different than what a patient considers normal.
I'm sure.
One that comes in here thinks they have a small penis, okay? And and so like that could be a 3 inch or an 8 inch. They all think
Mm.
it's small. Um, and obviously, as you know, that's there's a
It's
wide
all in
range.
the eyes of the beholder. So
Exactly.
let's just go there, right? So I'm curious, as you've done this work, what's the most common concern like men have? Like, okay, I'm going to go through this. What's the thing that scares them the most? Even though they say they want it, what scares them the most?
Well, so it's a medical procedure. So I think if we're talking about something that they're actually scared about, then it's that there's going to be a needle near their penis.
Mm-hmm.
Just exactly what you would think.
Yep.
I will say that almost uniformly 100% of the time when they leave, they're they'll say something like, that was a lot easier than I thought it was going to be, or that was no big deal at all. And then on top of that, the procedure that we do has immediate effect. So not
Mm-hmm.
only they say that it wasn't that bad, but they can see that it's bigger already. So I think that kind of um, makes the situation a little bit more tenable, if you will.
Sure. So I'm sure there's a wide variety of what guys come for. So are most of them like, I want more length, I want more girth, a combination of both? What is like the thing they're seeking out the most?
Well, so for starters, there's not really a reasonable way to add length onto a penis.
Mm-hmm.
You can stretch it, and that's probably the only way that actually works.
Gotcha.
And stretching it, meaning like over time, over months and maybe
All right.
even years, then you can make it longer. Um, Everyone wants a longer penis, but it's not a thing that you can actually have. So we're talking about thickness usually.
Mm-hmm.
By the time someone gets into our office, they already know that these are people that want to have a thick penis.
Mm.
Um, Whether it's that they want both and they can only have one, or that
One.
they're concerned about thickness, that's all we're doing here is making it
Mm-hmm.
thicker. So the good thing is we can make it as thick as they want. And so we have quite a range of how thick people want to get it done. Like we have people that want it to just be subtly bigger than what they have, and we have people that want it to be 3 times as thick. And it's all possible. It's just like the analogy is like breast implants.
Mm-hmm.
You can go from an A to a plus, or you can go from a B to a quadruple D.
Right.
It's all possible. Whether or not it looks good or normal is a different story, but it's all possible.
I know that many guys probably listen to this. As soon as you brought up the needle, it's like, oh, I don't even want to think about it. I mean, I've had catheters. I do not enjoy that whatsoever. I don't think anybody who says they enjoy a catheter, I'm like, okay, you're definitely into BDSM in a weird way, but go for it. However, I mean, the needle is probably not like huge, I would assume. It's not like, oh my gosh, it's 6 inches long and it's going to take us. So kind of walk us through like, that fear point of, oh, there's going to be a needle that goes in my penis. What should
Yeah.
men expect?
Well, I'll say that I would rather have a filler needle in my penis than have a catheter.
Yep.
Catheters actually hurt, and they hurt for like a long time after too.
Exactly. Yep.
This is a needle in the skin, right? It's not
Mm-hmm.
actually in the it's not in the functional part of the penis. It's in the skin.
Yep.
We're making it thicker by making essentially the space under the skin thicker. So what you have is a pretty thin needle, like a 25 gauge needle, which is,
Mm-hmm.
for comparison, maybe a little bit thicker than what they give you a vaccine with or something like that. And we use that needle to numb the skin. And then we use what's called a aesthetic micro cannula, which looks like a needle, but it's not sharp. And that's what we use to inject the actual product. So these are very small needles. It's in the skin, everything's numbed, and so it's really pretty benign as far as, and like once we do the numbing, there you don't know there's a needle there, you don't feel anything.
Right. So I know a question that I was talking to a friend of mine about this, interviewing you. And he's like, well, I have one question I want to know. I'm like, no, you don't. You have hundreds of questions. I know him too well. He probably could have done this whole interview and I could have just sat over in the corner and observed it. But one of his questions was, are we just enhancing the girth of the shaft, or is there enhancing the girth of the, what I'm just going to call in simple terms, the head, or is it all of the above?
All the above. Most of the time we focus on the shaft. That is because it's kind of it's a better procedure. Injecting, so for your listeners, we're talking about injecting dermal filler in the penis. I don't think we actually addressed that yet. So that's the product that we're using to make it thicker. There's a lot of nerves and blood vessels and whatnot in the head. That's where your sensation is. And if there's a place that's going to be painful, that's where it would be. So practically speaking, it's easier to inject in the shaft. It's less painful. It doesn't really bleed when you do it. And it doesn't really cause any long-term effects. You can inject in the head to make the head bigger, and some people want us to do that. But it's not as straightforward a procedure. It can cause decrease in sensation temporarily, and it can have some bleeding and bruising and stuff like that that you don't normally see when we're doing the shaft. And then the other thing is it doesn't last as long. So, and this can be quite expensive. So the amount of time it lasts matters quite a bit. And so if I tell you we're going to inject the shaft and it's going to last 2 years, and the head, it's going to last 4 months, and it's going to maybe hurt a little bit more and have some more bruising, and you might even lose sensitivity, you might not choose that option as quickly as you would choose the shaft. Having said that, a lot of people want both, and it's totally fine. It's something that we do sometimes.
What's the average age of someone who comes in for the treatment?
I would say about 35 to 40.
Okay.
So
that doesn't surprise me. I mean, I think there's that interesting space where, I think men come to terms with their manliness or manlyhood, so to speak, at some point. I know I finally just really accepted my, my girth and everything in my late 40s, in my early, late 30s, early 40s, as I came out of the closet, because I felt like, I wasn't big enough. I wasn't going to ever entice anybody, all this sort of stuff. And then as I started to be more myself in the gay world, I was very happy that people were like, hey, I'm really excited for what you have, because I'm not huge, I'm not long, but my girth is pretty, I'm going to say substantial on the average guy. And there are friends of mine like, I would give anything to have that kind of girth. I'm like, okay, it doesn't really make any difference. I mean, I guess it does when, I'm penetrating somebody. That makes a big difference. So the confidence it brings, do a lot of guys, like, I'm sure they must start to unload on you, like, here's why I really want this. It's what I'm most expecting. Is it more the look? Is it the sensation? Because we haven't discussed that either. If this is a filler, does it affect the actual sensation in your penis?
It more affects the sensation in the partner, because it's, you just alluded to, it's bigger. Right. It doesn't really affect your own sensation. To answer your question about if people tell me, I would say that normally the conversation when we're doing it is more like what you're using the penis for. Like, it's like, oh yeah, are you married, or do you have a boyfriend? Are you partying? Are you know, that kind of thing.
Right.
Not like I don't necessarily go into the details about what is your concern or whatever.
Right.
Because everyone has their own thing, and it's kind of maybe it could be maybe uncomfortable for people to talk about their inner like personal insecurities and stuff like that.
Right.
And and to be honest, it's more fun for me, and I like to have fun when I'm doing my work. It's more fun to hear the stories and
Right.
what you're doing, you know? So,
Yeah.
and I hear all kinds of crazy stuff.
Oh, I'm sure you do. I'm sure you do. As you've worked through this, and you alluded to, like, this is something that, you decide, hey, here's the path we're going down. This is what we're going to do. Has there ever been a time where you're like, okay, I don't know. I don't know if I even want to do this anymore, because I mean, I know many people in the medical field get burnt out. I'm not trying to say, how could you get burnt out on, like, doing penile injections, but is there ever been that, like, I don't know how long I'll do this, in your own mind? Or is it just, it's a good business? It makes you, it helps you fulfill other people's lives. I know that's, guys, don't take that the wrong way, but it does. It's got to help other people fulfill their lives in ways that they feel less fulfilled. But is it fulfilling for you to be able to impact people's lives in this way?
Yeah, I think there's a few things. Number one, I think whatever job you have, eventually it becomes a job. So
Yep.
that's number one, right? Whether it's, um, I've been an anesthesiologist now for over 15 years, and it does when you start doing it, or even just when you become a doctor, at first you're all excited, like, oh, I'm going to help people, and
Mm-hmm.
get to do these procedures, and it's interesting, right? But eventually it just becomes a job, and
Yep.
you don't have to really think about what you're doing, even you just do it. And so it injecting when I'm injecting penises right now, I've been doing it for 3 years. Some days you go to work just like any other job, and you're like, I'd rather be at home with my kid
Right.
or my wife or whatever, right? I mean, it is a job.
Right.
Also a business I run, but so there's that responsibility. Like, we have staff, and we have people, and we have patients that depend on us. They've been here before, and they're
Mm-hmm.
coming. Having said all that, it is very rewarding, because I don't want to say we're helping guys, because it's not like guys have a problem per se that they need help with, but guys are coming in here and they're leaving feeling good, right?
Right.
And so that feels good. Whatever job you have, you want to make an impact. And
Mm-hmm.
I make an impact when I'm doing anesthesia, because people are sick and we're putting them to sleep so they can get their gallbladder removed or their
Mm-hmm.
cancer removed or whatever it is. But on this, when you're doing penile enlargement, it's more satisfying in a way, because people don't have a problem, right? They're
Mm-hmm.
just you're just making them happy. Um,
Well,
and
it is very similar to breast augmentation. It's the same sort of thing. Some people do get breast augmentation, or, enhancements and everything, because they need it. They want it. They desire it. Sometimes it's a medically, necessary sort of thing. I see this, and again, I've talked to a couple of people knowing this conversation was coming up, and one was like, absolutely not. I'm fine with what I am. I'm like, okay, cool. And he goes, and I don't know why anybody else would do that. I'm like, that's because it's not for you. I said,
right,
but if somebody feels like it's for them, I'm all about, I mean, to your, words of wisdom here about, work becomes work. There's days that are even recording the podcast, I'm like, okay, let's let's just go get this done, right? But I
right,
try not to be that way when I'm on, the microphone and everything. But then I always remember, even if all I'm touching right now is one person who's like, man, I've always struggled with, feeling comfortable about the size of my penis and all of this sort of stuff. If this helps some person go, oh, okay, there's a possibility here of something I could go explore, I feel fulfilled, like, hey, maybe somebody didn't know about this sort of procedure. And so I think it's really valuable to be able to be showing up on the freaking planet the way you do, and going, yeah, am I saving lives? Maybe not, but in radiology, you're helping save lives. here you may be saving somebody's life in a really interesting way, who's like, I don't feel good about myself, and I'm not even going to go and even try to date or be with a guy or a woman. You know, there may be some bisexual guys listening to this, because I have those followers too, but they may feel like they don't present well enough. So what's the point of even attempting? So I think
Yeah,
it's
and
really
I'll
valuable.
even one up that. You might have a guy that has no confidence issues at all, but is having fun and
Mm-hmm.
having more fun,
Yeah,
right? And so
exactly.
that's there's nothing wrong with that, right? It's like I don't need to be saving someone's life to feel like I've been valuable. I mean, not that we were questioning whether I'm valuable, but
Right.
it's good, you know, people having fun is a good thing.
Mm-hmm.
And if you can have more of it, that's good. If you have a self-esteem problem and we can
Oh
fix
no,
that.
let's not have fun.
Right,
You've had
exactly.
fun, you're
Well,
done. You know, you've
I had
experienced
doctors,
fun once in your life. There you go. So
I think I had a plastic surgeon. We were doing like a breast, some sort of reconstructive thing for cancer, and I was telling her what I did and with the penile enlargements, and she said, "Oh, like how could you do all this training, this medical training, and do anesthesia, and then all you're doing is just making people's dicks bigger?" And I'm like, "You don't understand, right? This is what I'm doing is way more rewarding to my patients than when I like put someone to sleep that has
yep.
some health problem and they wake up and they still have the same health problem, but they're missing like a body part or something like
Right.
that. Right.
Yep.
I feel actually way better about this. What I'm doing is a guy comes in, he has a thing he wants done, we do it, it works, everyone's thrilled. There's no negativity there at all.
Yep. So I'm assuming it's outpatient, right? You come in, you
Yeah.
get it done, and okay, yeah. I mean, I didn't want to assume, but I've done a lot of research to go, yeah, this is an outpatient procedure. You did allude to that, you know, the length of time that it lasts. So is 2 years kind of the average for this filler?
Yeah,
Is
we
what?
tell people 2 years. It's a little different in everyone. I've
Hmm.
seen guys like some of my first patients now have come back and they still have the filler, or they still have a lot of the filler. And I've seen guys where it lasts substantially shorter than two
Hmm.
years. But that's just because our bodies just metabolize everything differently.
Hmm.
But I think on average it's 2 years, and that's kind of like what in this field of medicine doctors tell people.
Yeah. I'm sure you get this question all the time too. Okay, if I'm going to put this stuff in me, is it safe? What's it going to happen to it? You kind of just alluded to the metabolizing piece, but obviously, if it wasn't safe, you wouldn't be able to do it based on, you know, medical practice and all this sort of stuff, correct?
Right. Well, there are fillers that are not safe, and there's certainly ways to make the penis bigger that are not safe. And not every doctor necessarily has ethics or has good ethics, right? So to say that I wouldn't be able to do it if it wasn't safe is maybe like an overstatement. But personally, I what I do in my practice, I want it to be effective
Mm-hmm.
and I want it to be safe. So I'm not happy like if I were to get a bunch of people that came in and they had complications and it didn't work and all those things, I wouldn't be able to sleep at night and I wouldn't be happy.
Absolutely. You know, it's kind of interesting, you know, that question I just asked you, because it's kind of like, you know, all the weight loss Wegovy's and Ozempics and all that sort of stuff that are out on the market now. And now we're discovering there's a lot of those that aren't, you know, under protocol and all this sort of stuff. And a friend of mine, I mean, I'm on Ozempic for my diabetes. So that's one of the main reasons. And it's done wonders. I mean, my A1C has come down tremendously. I've lost a good amount of weight. I'm not taking it necessarily for the weight loss. It's more to keep the diabetes down. And he went on it to lose weight, but he also didn't get it through, I'm going to say, through the normal prescribed means. And he had not the best experience with it. And so it's always interesting to hear, you know, that story behind everything, because I have seen, you know, I kind of vetted, you know, I'll be honest, I kind of vetted you before I said yes, because there are a lot of people out there that are claiming all these things and all that sort of stuff. And the more I dug into some of those, I'm like, I wouldn't even think about putting somebody on the podcast that I didn't think was aligned. I've had other ones that have, worked on other areas of, penal enlargement and stuff like that I felt really good about. But I always say, you've got to have the relationship with the person who's going to do this, vet them, understand what they're using, all that stuff, because at the end of the day, that's your responsibility as a human for your own self. We trust our physicians, we trust our medical practitioners, but I think the beauty is if somebody's I'm saying volunteering, this is not like something that has to happen. The onus is on you as an individual more than it is, in my mind, on the practitioner who's doing the service for you. So
yeah, I think it's like it would just be naive to think that everyone out there, like every doctor out there, is perfect and following all the ethics and the rules, right? And in this industry particularly, it's known to have a lot of gimmicks and a lot of scams. And some of those scams involve doctors, and some of the gimmicks involve doctors. There certainly are products out there that I don't think are safe, that I wouldn't get done, and they might even be FDA approved, for example. But the thing we do is fairly minimally invasive. It's just injectables. There's no surgery. There's no cutting anything. Fillers, as your listeners probably know, are used in the face and have been for a long time. And while like anything has potential risks, the risks of injectable fillers is relatively low. As far as vetting your doctor, yeah, I think that's really good advice. We get it's funny with guys, like I don't know if women are the same when it comes to breast enlargements, but we get a lot of inquiries from guys just on the price. They're just like, oh, your price is this much, and this other doctor is doing it for this much. And I don't answer the phones or whatever, but every now and then I see like text messages come through, and I'll chime in and say, like, you might want to do some research on that actual doctor, right? Like, who's the guy putting the needle near your penis? Or it'll be a thing like, yeah, I live in San Jose. I don't want to drive all the way to San Francisco, which for your listeners is a 45-minute drive or something like that, right? So
on a good day, let's be fair. On a good day,
okay.
Yeah.
But it's like if it's your penis, right? Then you would think you would do the extra, like, and whatever. If you live in San Jose and you drive to the other side of San Jose, it's not like that's 5 minutes. So it's like, yeah, you don't want to drive the extra 30 minutes to go to the doctor that you vetted or whatever.
Well, so, but again, it's like what you're willing to do. I mean, as a coach, as a life coach, people price check me all the time. I'm like, here's what I'm known for, and this is my value that I state is what I get when I work with clients. If that doesn't work for you, please go find another coach that you think might work for your price point. I'm not going to say it makes me any better, but I know what I can command given what I do and my expertise and the number of years I've been doing all this sort of stuff. So I feel like it's really interesting to just watch people's perceptions around these sort of things. Like I vet my dentist. I remember even back when I was getting, orthodontia done, we vetted the orthodontist a lot because my folks couldn't really afford the whole orthodontist thing. But if we were going to do it, we had to find it, like, if we're going to spend the money, let's get the best we can really afford. And we didn't go for the cheapest. I know that. We didn't go for the most expensive, but hey, I still have a pretty good darn pair of teeth right now. So
isn't that the deal that you never go? It's like with contractors, right? You never go with the cheapest guy and never go with the most expensive guy. So
absolutely,
I guess we could say that with dick doctors also.
There you go.
Go for the guy.
What are you most enjoying at this stage about this being part of your world and your life?
I like the people that I work with. I have, like, in my actual office, it's mostly guys. There's one girl, but mostly guys, and we have a good time. Like, it's actually a fun place to go to work. At the hospital, you have to be a little more serious, right? You can't watch YouTube videos with your friends and stuff like that. You can do that. It's my office, right? I can do whatever I want.
Exactly.
So I like that. And I like the schedule I have. Like I don't I kind of work what I would consider reasonable hours instead of you know, 2 in the morning till 5 in the morning or something
Right.
like that.
Yeah.
And yeah, I get to travel a lot because I have multiple offices.
Mhm.
And there's some business aspect to it also. Like
Sure.
even though I'm a doctor, I'm not only doing medicine now, I'm running a
Mm.
business.
Yep.
So I think all those
Big
things are
difference.
important.
Big difference. So, is there anything I haven't, shared or asked you to share with the listeners you feel like needs to be shared if they're considering something along these lines?
Um, yeah, I mean, I guess we covered quite a bit. I can just give a spiel that I kind of give my patients,
Cool.
and that might be worthwhile to whoever.
Absolutely.
So, as we first alluded to, it's a thickness procedure and it uses like a fairly small needle. Usually you end up with about 3 to 6, or I'd say 4 to 6 injection points.
Hmm.
Um, so you don't really feel much except for the numbing going in there. The procedure takes about an hour. It uses the same dermal filler that's used in the face. So it's hyaluronic acid dermal filler is the most modern thing. And it lasts about 2 years. The prices start around $4,000 and they go kind of, the sky's almost the limit, but generally speaking, to get this done, it's probably around $7,000 or so. So it's not the kind of thing where it's expensive. It's not the kind of thing where you should be doing it if you don't have that kind of money available. Like I
Yep.
don't actually like when people don't make their car payment because they need large, right? Like, and I'm sure that
Right.
happens, but
Yep.
I feel better
I
about myself when it's people that can.
I can relate to that. I mean, if and I love anybody who wants to consider coaching. I think coaching is a really powerful, part of, mental health. It can be something that maybe therapy isn't working, but coaching sometimes can. And, as much as I wish I could, I can't take insurance. And, then I have people that like, well, do you have a financing plan? I'm like, you don't want to finance your coaching. I mean, you don't want to
Right.
be paying for it 2 years from now on something that lasted 3 to 6 months, And so I feel for those people. And that's usually when I'm like, hey, here's alternatives to this. So I hear your point really well. It's like, why
Yeah.
do this if 2 years from now you're going to be paying for it and suddenly it's time to have it, redone again. So, and I think for most guys that are, some guys are going to be listening to this going, well, it's just for men who are really vain.
I
Not
don't think that's
really.
true. No.
I don't think that's true either. It's like somebody who says, I'd like this. This is for me. I mean, I can be honest with you guys. If you're listening and that's kind of where you're going, cool, have that moment. But also, I want you to think about how many of you spend not $7,000, but maybe you spend some substantial money a month on your haircuts.
Yeah.
Same
Well,
thing could be said,
I could tell your listeners that you have no idea which people actually have a dick enlargement.
Mm-hmm.
Dentist does, your pediatrician does, your veterinarian does, your lawyer
Yeah.
does. All these guys I see in my office, right?
Yeah.
And a lot of times it's the last person that you would think would be getting this done, but it's just
Mm.
normal guys that
You mean you don't give them like a little pin to walk out with, like on voting day, and like I just
yeah.
enlarged. So
Well, we actually have pens and all kinds of stuff like that, but yeah, people generally don't. Like I have cards and I'll give them my card and they're like, you know what, I'm just gonna write your number on my phone.
yeah, I'll just put, yeah, I get it. Yeah, totally get it.
So I mean, some guys don't care, but so a lot of guys do. I mean, I have I've got guys I've just met at parties or whatever.
Mm-hmm.
And I don't mean like parties, just
All
you're at
right.
a dinner party and you meet someone and then they call you a couple of months later and they say, hey, remember we were talking about this
Mm-hmm.
thing? Can I come in and get it done? So it's just everyone. I mean, people, it's not a weird thing. It's a new thing that a lot of guys
it's
know
newer.
about, but it's not a weird thing. And
Yeah.
I think the listeners would be surprised to what kind of people come and get this done.
I'm sure. Well, Joel, thank you so much for being here and walking us through this, because there are guys that I know that would like, hey, this might be a really good thing for me. And because it is a newer thing, I felt like it was a really good opportunity to talk to my guys, especially guys over 40, because some of them are like right in that space where it's like they may be coming out or they've been out for a while and they're like, something I just want to do, to make myself feel better or to look better or, to pleasure somebody more, whatever it might be. And that's why I felt it would be a really good match to have you here. Again, Dr. Joel Pash, we will have your website is, let's shout that out before we wrap up here.
So it's upsizematters.com.
Excellent. And then you can look, because I was on it earlier, and you can look for a doctor in your area. You can scroll through there, depending on where you live. You'll find Dr. Pash several places. But anyway, I really, truly appreciate you coming on and just being so candid and like being able to have this conversation and help guide some guys, hopefully to some place that, like, if this is really for me, they'll pick up the phone and call and do something. So thank you so much, man. Truly appreciate you.
Thanks for having me. It was fun.
That's a wrap for 40 Plus. Gay men, gay talk, where size doesn't matter. We drop our bullshit, get over our screwed up fears, make bold moves, and live life without apologies. Don't forget to join us on Facebook at 40 Plus, Gay Men, Gay Talk, where the conversations continue.